Hello, everybody. My name is Aaliyah Brockbank, and I am the Practice Development Manager for Sinclair. Thank you so much for joining us tonight. We really appreciate it. And believe it or not, I am not the one hosting the webinar tonight. I'm here for assistance and support. I do have a very special guest joining me tonight. Her name is Dr. Nicole Hayre, and she is a board-certified cosmetic dermatologist out of Virginia. She is an incredible KOL of ours. We are so thankful for her and her support. And she has owned her practice for over 20 years. So she is just so truly insightful and knowledgeable. And what she'll be speaking on tonight is our latest technology called Enerjet. You've probably heard a lot about it lately on social media. And when I say latest technology, sure, it is newer to the North American market, but it has been in Europe and other countries for over a decade. So the amount of clinical data and studies and before and after photos we have on this technology is so incredible. So Dr. Hayre will be going into a clinical deep dive and just talking about how truly revolutionary and versatile this technology is, and just talking about her experience and her results with it. So without further ado, I'm going to let her take over. I'm just going to pin her really quick. Thank you so much, Dr. Hayre, for hosting tonight.
Hi, it's my absolute pleasure. Uh,
Yay.
and I'm happy that you're here to help me with the technology.
Yes, absolutely. I know this Zoom thing, but also I forgot to add, she will be taking questions at the end of the webinar. So it will hold your questions, and at the end you can pop them into the chat. Alrighty, I will let you take over.
Okay, awesome.
And I will just click through for you. All right, can you see it okay?
Okay, perfect. Sorry, everybody. I'm
Oh,
really
no
good with
worries.
lasers
Got
and
it.
needles, but with computers, we just don't get along. Um, So anyway, I am Dr. Nicole Hayre, a board certified dermatologist, and my practice is right outside of DC. It's in Northern Virginia. And as Aaliyah told you, I've been there for over 20 years now, which is crazy. It makes me sound so old. But it's a lot of fun, getting to know your patients and seeing some of the same faces come in year after year after year. And part of the fun thing is being able to introduce new things to them over that time, right? So you always want to make sure that you have something innovative and to kind of keep them happy, keep their interest. And that way also they know that you're on top of things on what's the latest and greatest, and you're not just kind of offering the same old stuff that everybody's been talking about for years and years now. So that, and we have the next slide. All right, so there are a lot of options out there, right? So which way do you want to go? Do you want to go with an energy-based device? Do you want to go with needle injections? And this is something that I was kind of alluding to, right, we have all these things that we've been offering for years and years and years, and someone will come in and you kind of do a quick assessment in your head, like, okay, what would I do for this person? But you really need to kind of think, what do they want too, right? Because you might see them differently than they see themselves. So that's always a great question to ask, is like, all right, when you look in the mirror, what bothers you? Because it is amazing to me sometimes people will come in and they'll be completely mottled with pigmentation, they've been in the sun way too much and you just want to start lasering those spots off, and then they'll bring up something totally different. You're like, really? That's what brought you in? So that kind of thing will happen. And, so you want to make sure that you're offering something that kind of speaks to them, I guess is what I'm trying to say. And the interesting thing about the Enerjet is that it kind of speaks to everybody because it crosses this bridge between energy-based and needles, right? So you will have people who are just plain out needle phobic, right? They don't want to have anything to do with a needle. And then you'll have people who come in and they just want, some sort of laser or technology being used because they think that that's the way to go. And this kind of bridges that gap. So it's really kind of a cool thing to do. And you can use, as we're going to talk about, You can use fillers, which is now almost an old-fashioned thing to use, right? They've been around forever now, in a really new way. So you're putting these fillers in a device and introducing them without a needle. So it's really bridging this gap in an interesting way. And in an aside, we didn't really mention, I went to MIT, so I'm very interested in science and research. And so I'm kind of, I admit it, I'm a nerd. And so, think about what do people like me like? Nerds, okay? We like sci-fi. So what happens in sci-fi when someone needs an injection, right? They whip out these devices that they can basically administer, almost anything with. They don't use a needle. When they inject them, right, there's barely any pain, and they're handheld. So they just hold them up, boom, they're done. Well, think about it, the Enerjet is the future. This is almost like that, right? You can introduce almost anything through the Enerjet. It's needleless. It basically doesn't hurt. So now we just need to miniaturize it and we're there. So it's kind of cool for all the nerds who are logged on today. I think it's kind of cool. This is the future. And it's in a way very kind of comforting to people when you have this technology that I think in the back of their minds, they're like, oh, okay, I kind of get that. All right, next slide. So it's really this combination that I've been speaking about of these two worlds, right? So you're using a device and you're injecting without a needle, and it's done in this really neat way. And so what happens is your compound is going in and it's being sprayed throughout the dermis, okay? So imagine, and I'm going to show you some graphics in a little while. It's just being sprayed out there, right? And so what happens to that solution or filler or whatever you're putting in there, it's going through in a high speed, right? And it's spraying out. So we call these little nanoparticles. And so this kinetic energy that's blasting through the dermis, it creates this micro trauma. And so, as most of you know, a lot of the devices we use and a lot of the techniques that we use, the devices, the microneedling, all of that, how do they really work? It's through creating this like controlled trauma so that your body then says, hey, wait, what's going on? Let's repair, right? So we get this repair. And when the repair happens, you're getting new collagen and elastin and some hyaluronic acid, and everything looks kind of better, right? So that's in part what this is doing. So now imagine if you can have the effect of that active compound going in. So you have the effect of the active compound, but then you have that longer term effect of the micro trauma inducing rejuvenation. So it's really neat. So we're not only bridging the world of a device, right, and an injectable, let's say, but we're also bridging this world of having a solution or a medication or a filler and that rejuvenatory effect of that kinetic energy blasting through the tissue. So it's really neat when you think about it. All right, next slide. So what can you do with this? I keep saying, well, there are all these things that we can load into this device and spray through the skin, right? One of my favorite things to do is the kinetic facelift. So I do mostly cosmetic work in my office. And so I do this the most out of all of these things on the slide that you currently see. So what's the kinetic facelift? So I'm going to use fillers, right? Hyaluronic acid gels, and I'm going to inject them without a needle, just using the Enerjet. And it's mostly hidden in the hairline. And I'll show you a schematic in a little bit on where that exactly goes. But think about it when you go in through the hairline, right? It's going to pull up. And for any of you out there who have been, as I have been getting older over time, right? If you've reached that age where you ever look in the mirror and you kind of like go like that, that's exactly what the Enerjet is doing. It's kind of pulling up the way people look in the mirror and they pull up with their fingers on the side of their face. So it's a very natural look. And it's an easy way also to explain to patients, like, well, because sometimes this is so new that they get a little confused, like, what do you mean? You're going to put in a filler, there's no needles, but what's it going to look like? You say, well, do you ever, lift your face up with your fingers and kind of pull it up? Oh yeah, of course I do. That's how it looks. And so it's really cool. You can use it on acne scars too. Very nice effect, just blasting that filler into the depressions of the scars. Keloid scars has been, for me, a little surprising how well it works. Because I was at first thinking, well, I can just use a needle, right? I've been doing that for years and just inject it and it's fine. Why would I need to do this? This works far better than ever taking a needle out of your drawer and injecting, a corticosteroid into a keloid. This is far superior. Same with hypertrophic scars. Dermal thickening or plumping is what we mean by that is when the skin is kind of older and thin and, it's getting a little too crepe paper-like and you want to plump it up and make it look more youthful. You can use the Enerjet for this. And the same thing with going through and necklines. And so lastly, coming around on that side, fine lines and wrinkles, of course, we're going to go after that too. It's kind of that dermal thickening method. Okay, if we can go to the next. You can hit it again, please. And again, yep, perfect, thank you. So here you can see a little schematic on that high velocity jet. And what's really neat is it shoots the solution or filler through in this tiny, tiny entry point. And then it just sprays through the dermis. And you can see in that second graphic there, all these little tiny particles spraying out. And you can get about a centimeter wide welt. So when you inject with the Enerjet, particularly with a filler, you get these kind of bumps or welts. And then in the middle is a tiny red dot. And they don't last long, these bumps. Okay, so I always explain to the patient, you're going to leave here and you're going to be a little bumpy where I treat you, right? It's going to look a little weird. But the bumps go away in like 2-3 hours. And in the middle is a little tiny red dot, and that's where everything got shot through. And that goes away in a day or two, really. And most of it, when you do a kinetic lift, is really hidden. So there's almost no downtime with the kinetic lift, which is nice because what you can do is on those patients who come in and they're like, by the way, I have a wedding to go to in a week and I didn't have time to come in. What can you do for me? You can actually, put some filler in and lift them up a bit with the Enerjet and not really worry about downtime the way you would with injecting traditionally with a filler. When you use a filler, even a cannula, you can bruise, swell, and all of that. Yes, it's possible to bruise with the Enerjet, but it's extremely rare. And they heal up so quickly. So, I think this is just another tool in the toolbox, especially for those last minute event patients. So we can go next. So again, here you can see the idea, excuse me, of the micro trauma. So that micro trauma is going to induce the fibroblasts to wake up and build more collagen and elastin, which all of you know is the building block of the skin, right? So when the skin is thin and it's getting weak and crepe paper-like, it's that lack of collagen, elastin, and hyaluronic acid. So it's not plump and vibrant. And so when this happens, all the repair mechanisms kind of get kicked in and over time it does improve. Can you see the next? So here's a little video and this is how the Enerjet works. You can see it's blasting through the skin and then you can imagine that welt kind of coming up and that goes away pretty quickly. Like I said, a couple hours. And you're getting immediate hydration and rejuvenation from the product that you are injecting with the Enerjet. And then long-term, you're getting your collagen and elastin building, which gives you a better effect, obviously, long-term. So here you can see that it's a really cool effect injecting using the Enerjet a dye into a gel matrix, and you can see how it just spreads out all over. And I want you to remember that when I show you what happens with a needle. Again, this is a high velocity jet injection, a pneumatic injection without any needles, and it goes in really fast through a tiny entry point. You can control the depth with the settings. And of course, that's going to depend on where you're treating, how deep you want to go, what kind of effect you want to have. And you get a nice lateral spread, again, about 1 centimeter. And you can use HAs and neurotoxins and steroids. I think it's also FDA approved for just medication injections in general, but it's super versatile, and I'm having a lot of fun with this. So you go to the next one, please. So here's a patient in my office. And you can see those are the welts I keep talking about, right? So on the left side, you see I've gone down, obviously, preauricular. And then on the right, I am directly in the hair, which at first is kind of weird. I'll tell you, when you're injecting filler just straight through the hair like that, it's kind of funny. I had to get used to it, but now I'm so used to it. You just want to make sure you're super good about cleaning it off with a nice alcohol scrub and tell them to come in without any product in their hair. And then it'll, it's fine. People do really well. And it doesn't hurt. I mean, I've had it done myself, and I would say on a pain scale of 10, it's a 2, sometimes maybe a 3, and that's it. So it's very well tolerated. It's loud. The video didn't really give you your sound here, but it is kind of loud. But while you're priming it, to get the solution or filler through to the tip, you have to kind of prime it. You hit it a couple times before that's coming through. Your patient will hear the noise. And I always tell them, okay, this is what it's going to sound like. It's going to be a little loud. And then they hear that pop, pop while I'm priming it. And they're like, okay. And I said, that's the worst part of it. It sounds loud, but you're really almost not going to feel it. And then they're fine. Let's go to the next one. So we'll talk about a little bit more about the biologic effects. Again, you have that controlled trauma, which is going to induce that wound healing cascade. And you're going to have a remodeling of the cellular matrix in the skin. Can you hit again? And you also have your compound, right? So you're going to have be able to do all of this and produce dermal plumping, skin improvement, remodeling, and also, it's more hydrated, right? Because you're injecting, usually for this kind of effect, you're using an HA, which obviously is going to attract water and bring some hydration to the skin. And now there's some even really nice thin HAs that have just been put on the market, especially for this kind of a thing. And so you're going to get better moisture retention, but also as the cellular matrix and everything is repairing, it's going to improve on its own too. We can go forward. Okay, so here, this is a little bit more about what I was talking about, that immediate effect and then the long-term effect, right? So the immediate effect or Cinderella effect, right, is what you're putting in there, right? So in this case, let's imagine I'm putting in an HA. So I'm going to have that immediate plumping and some hydration from the HA. And that lasts, a certain amount of time. But then again, that micro trauma that is occurring as the HA is being blasted into little nanoparticles throughout the dermis is going to induce collagen remodeling and stimulation of repair. So let's go to the next one. So for, how safe is this? It's extremely safe. Can you hit it again? I think there's one more. Yep. That's the important part there. No damage to big vessels. So the material was not shown in their studies to penetrate into large vessels. So it has enough energy to kind of spray through the dermis, but it's really not penetrating those vessels. So, you obviously, I wouldn't just go right over a huge vessel and just shoot if I see something super obvious, but you don't have to be obsessed, and you can just kind of click away, and it's safe, which is wonderful. Go to the next one, please. So again, we're going to talk about my favorite Connect facelift. So this is where I've really played around with the device, and I've had it for, I don't know, maybe a year and a half, 2 years, something like that. So, so this is the standard protocol that you see here, and you can see all the little circles on the schematic are injection points. And you see how they kind of go out into the scalp there and kind of around the ear. So that's where sometimes you'll really kind of vary from the protocol. You need to just kind of put your hands on the patient and see where's the laxity, where's the wiggle, right? So if you go and you're pulling up in a spot and that creates a nice lifting effect, something that you desire to see, that's a good spot to inject. If you're kind of in a spot, especially sometimes behind the ears, a lot of my patients, when I pull back there, it doesn't do anything. So I'm like, you know what? We don't really need to be here. We don't really need to inject there. I do have some patients that are so lax. And if you look at that red part that's extending through the temple there, that's where I'll really pack it in or extend even way further back with the injections, because they need it. Or sometimes I'll treat half and then I'll treat the other half. And I might even go back to the first half and just top it off a little. And then the second, same thing. You don't want to overdo it at once in a certain area, because obviously you don't want to have too much pressure on the structures there. But it's so safe. You can really, pack in the injections and extend back. And, when we think about it, the aging process, we're all very aware of, and we tell our patients, well, the reason why you need filler on the face is because your fat pads are shifted. And, this is creating the illusion of laxity. They might also have intrinsic laxity in their skin, which compounds the issue. Plus, the bones are shifting, right? We're aware all of these things are happening, but we don't really talk about, that subcutaneous fat in the scalp is also diminishing, because, when this diminishes and this starts to come down and then everything's kind of sinking, you start filling in up here, it just kind of lifts the whole face, and it's really beautiful. And again, a very natural look. So now I have some before and afters that I'll show you in a little while. And so it's a really fun, interesting procedure. It's easy, it's safe, it doesn't hurt. There's almost no downtime. I mean, it's like a win-win-win. All right, let's go to the next one. So here again, the dermal thickening, or you can do the necklines or tech neck, people call it now. And you can just kind of go right in the lines there and fill them in. Or if someone's older and they need some dermal plumping kind of more globally, you can do that. I had a question last night on the Instagram Live, which fillers do I use? So I did start off with a very thin filler. When the trainer came in and, she was saying, well, we need to look at the cohesiveness of the filler. And, we kind of looked at the Restylane line, because that's what I use. Excuse me. So we're looking at the Restylane line, and the cohesivity was the best with Refine. So we started off with the refine, and we had a nice effect, but I didn't feel like it was enough. And I'm someone who's always kind of striving for more. And so after a little while, I was like, you know what? Let's play around with this. I don't want to look so much at the cohesivity anymore. I want to look at the G prime, right? So looking at the G prime, for those of you who are familiar with Restylane, I went up to the define filler, and I got a better result. And I was super happy. It still worked. It still went through the device properly. Everything was fine. And then I said, you know what, I'm going to go for it. Let's put in some lift. And boy, it makes a difference. So using lift for the kinetic lift is fantastic. I love it. So, I always kind of approach the patient with like, what do they need? They need lift. I'm going to go for a G prime that's going to give me more stiffness and lifting. Now, sometimes you need to adjust the device a little bit to be a little bit, more pressure to get that thicker filler through, but not a lot. And it doesn't hurt even if you go up in that. Now, if I'm doing a necklace line, right? So think about it. If you're going to inject someone there, right, you're not going to use a lift. That would not look good, right? And that thinner skin, it's going to show, it's going to look a little lumpy probably. So in this case, I would use something thinner. So here you can use, depending on the patient, a define, or maybe even going back to the refine. So, same with dermal thickening in general, not just the tech neck or necklace lines. You want to think about and approach it in a thoughtful manner. What am I doing here? What kind of filler, if I was using a needle, what filler would I use? And then just use the same filler. Now you do need to dilute it and load it into the device, right? But you're going to use that same filler that you would have used with a needle and just, dilute it to the proper dilution, put it into the Enerjet and go for it, and it will work. It's really neat. Let's go to the next one. So here, I told you a little earlier, I was a little skeptical at first, like, why do I really need to use this device for keloids? But I love it now, and I'll show you why. So you're looking at your keloid here and think about here, I usually use just a Kenalog, a corticosteroid, and I usually inject it, and you're going in to suppress the fibroblasts, right? And to break up that scar. So you can do the same thing, even better, with the Enerjet. So let's go to the next. And here you go. So needle, if any of you have done this before with injecting in a keloid, sometimes it's really hard to get that injection to even go into the tissue. Some of these keloids, they feel like they're rocks, right? And you're pushing and pushing, you're thinking, gosh, I'm not getting enough in here, right? So, it can be just technically challenging, some of them. Whereas with the Enerjet, it's super easy. The device does all the work and it just sprays that liquid through that very, very dense tissue for you. And again, it really doesn't hurt, and you can get it just precisely in there. So let's go to the next. So remember, I was telling you about the dye in the gel. Well, here, this is comparing injection and the Enerjet. So imagine, right, you have your injection, which you see there on the left, and you're pushing and pushing on that needle into that rock hard keloid, and then you get that little bubble of material there, right? And so what's it working on? It's only really working on the cells that are basically right there, right? So if it's kind of a thicker, bulkier keloid, that medication may not be getting to much at all if it's just being held in that little spot. And now imagine you're using the Enerjet, right? And it just sprays that corticosteroid all through that hard tissue for you. and it's doing all that work. And more of the tissue is being treated because it's being exposed to the medication. Whereas in the needle injection, not all of the tissue is being exposed to the medication. So let's go to the next one. So here are the papules again. Remember, they go away pretty quickly. So they leave looking really bumpy. The kinetic lift is almost hidden in the hair when they leave. The necks are obviously more obvious, but it goes away so fast. And then the little red pinpricks, they're really not very noticeable. So let's go to the next one. Here's some dermal plumping, and you can see before, immediately after, and then 1, 4, and 6 days later. And you can see her skin looks a lot more hydrated and plump. And imagine if you were to repeat this, right? And then you have more plumping over time. So that, again, is something that you repeat, it improves. I should have mentioned also with the kinetic lift, you repeat it and it improves. So typically with the kinetic lift, I'm doing 3 treatments and I'm spacing them 1 month apart. It's the same with everything. I space it about month apart on dermal plumping and keloid scars and all of that. And again, it doesn't hurt. And so they come back and they do the treatments and they keep getting more and more improvement, the more medication you put in. And then again, over time, the remodeling of the tissue gives you further improvement. Okay, so let's go again. So here's some more studies. So here you can see the ink deposition showing you where things are being deposited, where the ink is being deposited, depending on the pressure used. And the higher the pressure, the deeper it's going to go, right? Pretty logical. Okay, let's go to the next one. And here's some studies showing increased collagen, increased GAGs, and increased fibroblast migration and collagen synthesis, all wonderful things that you want to have happen after a procedure. And yes, you can, use a lot of different ways to increase your repair and your collagen, but this, you're getting that double effect of having the product in and the rejuvenation effect. All right, let's go again. Here's a little study just showing how the brow was lifted after kinetic lift. This was 2 treatments a month apart for the interval. So let's go to the next one. Dermal thickening study, and the important part here is you're looking at all of the positive effects are increasing with time, right? So you have your before, after 3 months, and after 6 months, and everything continues to improve. And you can see here it was a décolleté treatment, and it's a very nice effect. If any of you have injected on the décolleté, even with a cannula, that area does tend to bruise easily, especially some of my patients, they're just older, and their skin is more fragile. So, I always warn them. But with this, there's almost no downtime. So it's a lot easier on the patient. Let's go to the next one. Keloids. So here you can see, again, all of these different aspects of the keloid are improving. And what I want to bring out and kind of bring your attention to is the bottom line under results, right? The pain. We forget sometimes that these things hurt. And, and again, I'm going to show you a case study in a little while where the lady, she was in a lot of pain too. I mean, yes, we think of these things as being very unsightly and for some people very embarrassing. But remember, some of these people are in a lot of pain. And if you can take that pain away, they're so happy and so grateful. Let's go to the next one. So here's some more of the fun part. So here's a kinetic lift, and this is just one treatment. So again, I would normally, treat this patient. This wasn't my patient, but you'll see some of mine in a little bit. But this was one treatment, and I would imagine that Dr. Mulholland did more treatments after this, but he threw this before and after one, and it looks great, right? So let's go to the next. Here's one of my patients, just one treatment. Same thing. One treatment already looks great. She did wind up doing 3 and looked fantastic. She loved it. And then a year later came back for more because she was like, that was easy. It worked great. I looked natural. I loved it. I want to do it again. Let's go to the next. Okay, this is a fun one. This is my husband. So he's my guinea pig when I get new devices in, and I'm like, hey, you got to come in. I want to try this out. So he came in, and he had a bit of laxity, and I was treating him, and he's more in the world of construction, and so I have this big thing in my hand, and I'm firing, and it's like pop, 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 right? And he's like, what is this, a nail gun? And I was like, I don't care what you call it. It's awesome. So for him, it's the nail gun. But you can see here, it's kind of exciting how he lifted after one. And honestly, he didn't even have lift because he was one of my first Enerjet patients. So he does need to do it again. He never comes in. It's just too busy. But what I also noticed over time was he looked better and better. So even though he only had one treatment, and I think it was with, I can't remember if he was refine or define, but he had one of the fillers that are a little thinner for the lift aspect, right? I would rather at this point take a lift out. Um, it still worked, is my point, right? So it still worked. He had an immediate effect, and then he had that effect from the micro trauma, and I saw him improving over time, and it worked very nicely. All right, so let's go to the next one. Here's another patient of mine after 2, and you can see her brow is lifted, her cheekbone positioning is improved, her jawline looks sharper. She looked fantastic. And again, very happy with it. She's actually a hairdresser, and her clients noticed how good she looked, and she looked very natural. Like they didn't really know, like, what did you do? You just look so good, and this is what she did. So let's go to the next one. This is a fantastic story. This is a very dear friend of mine. I've known her for, I don't know, 29 years or something like that. And I said, hey, why don't you come in? I want to do this for you. And I say, we're going to do 3 treatments, and it's easy. I think you're going to like it. And unfortunately, she lives a little far away, but she made the trip. And so when I examined her to see, where is she moving? Where am I getting, the wiggle? Boy, did her skin move. And I was thinking to myself, oh my God, is this even going to work? How am I going to get her to lift? Her skin is so lax. I was really surprised because she's a little younger than me. And I was thinking, oh no, I told her 3, it's going to take at least 6. How am I going to get this to work? There's too much laxity. So we just moved ahead with the plan, and this is after 3, and she looks fantastic. And you know what? Each time she came back in, she was significantly better with the laxity, and it was really interesting to see. And so I think at this point, I would say the people who have more laxity, they actually do better because they need it more. They need that rejuvenation more. They need that structure, the structure in the dermis to be rejuvenated, the extracellular matrix, everything needs to be improved. It has diminished for whatever reason, genetic, environment, whatever it is, and they need that stimulation to help with it. And she did great. She looked fantastic. And even though I panicked in the beginning, thinking to myself, oh my gosh, it's going to take at least 6 treatments. Here we are after 3, and she looks much more youthful. All right, let's go to the next one. Here's another one that was 1. This was done in Russia. You see her jawline, that looks really nice. So let's go again. Here's some dermal thickening. Again, much smoother. This is 3 weeks after 1 treatment. I would say she looks great, but I still see some irregularities there. I would probably treat again. And again, for this kind of dermal thickening, for her, I might use a define. You could use a refine, but you're not going to use a lift for this kind of thing. So you want to use that a little bit lower G prime for this. All right, let's go to the next one. Another dermal thickening. It's a very nice effect. Still has some lines after 3, but greatly improved. And her pores are improved too, right? You got to notice that. That looks much better. Let's go to the next. Here again, décolleté, nice effect. In this one, I would probably use a refine. And so a thinner filler that's gonna just kind of, give that nice plumping effect on that thin skin right over the bone and all of that. You want to use something nice and thin. All right, let's go to the next one. Here, acne scars. So it's great because this, again, this is a colorblind treatment. So a lot of acne scar patients who have a darker skin tone, they're going to be very limited with what they can use. I mean, RF has been really nice with helping out to, the RF is pretty colorblind, but so is this. This is great. You can treat anybody. And here you have a nice effect after 2 treatments. Obviously, I would go again on this one and see if I can get a little bit more out of that one. Let's go to the next one. Some more acne scars, beautiful after 1 treatment. I mean, that's wonderful. Let's go to the next. This is my patient I keep alluding to with the scars. So this lady came in to me and she had a facelift several years prior. So she had these hypertrophic and keloid scars completely around her ears. She was completely embarrassed by it. She custom made earrings to hide it, wore her hair forward. She was absolutely miserable. She came to me and said, I have this. I see you have all these devices. I saw your website. What can you do for me? Can you help me? And I looked at her and I thought, Enerjet. Let's do the Enerjet. And I told her, you know what? I think I do have something for you. I think this is going to help. So we did a treatment and she came back a month later and she's fighting the tears back. I'm not exaggerating, fighting the tears back, thanking me, because what she hadn't mentioned in her consult was how much pain she had been in. And she was feeling so much better. Almost all the pain was gone. And she was absolutely thrilled. It was the first time, and she had been seeking treatment for years. It was the first time in years that she had an improvement. She had traditional injections with a needle multiple times before in multiple offices, and it did nothing. And here we are. I did 1 Enerjet, and she looked better. So of course we repeated. This is after 3, and you can see all of that thickening is greatly reduced. Her pain was pretty much almost gone. And she was super thrilled and had started to wear her hair differently again and all of that. And think about it. She went in for a cosmetic procedure to feel good about herself. And then this happens, it's devastating. Let's go to the next one. So here, this is under her ear, a great improvement. Again, this is not necessarily maybe the cosmetic aspect hidden behind the ear, but it's pulling on her and it's hurting. So, it's all connected and it's a great improvement. All right, let's go to the next. And the other ear, you can see before and after. Again, that's 3 treatments. She's still in treatment. I haven't seen her in a little while. I know she was traveling. So hopefully I'll get even better afters in a little bit. But yeah, it's been really nice. Let's go again. So here's another scar treatment, and you can see this is 9 months after 8 treatments. Very nice effects. Let's go again. And another one. And so you're getting the idea. This is it's a wonderful, effective treatment. In my office, like I said last night, I do not have this type of case walking in every day, right? This is not my bread and butter to treat keloids. I do far more kinetic lifts than I do for keloid, but it's very, very satisfying to be able to offer a treatment like this for these patients who are miserable from these scars, and especially when they've had treatments elsewhere and it's failed, and then you're able to do this. So it's very nice. Let's go to the next. And here is another just extreme case, but this one was done with Depomedrol and a 5-FU solution. And after 1 treatment, I mean, that's a miracle to me. That looks incredible, I think. Okay, let's go again. So again, let's wrap up and talk about what can you do with the Enerjet. And, it's safe for anybody. It's any skin type, any age. It's wonderful. It's extremely versatile. You don't have to worry about burns or laser burns or anything like that. You can do it all year round. You don't have to worry about sun exposure and all of that kind of stuff. The bruising and the downtime is extremely minimal. There's I think I've seen maybe 1 bruise on someone with extremely fragile skin. But it's really almost no downtime. Again, all skin types, penetrates into the dermis, and it creates that micro trauma, right? So that micro trauma is giving you that beautiful, beautiful effect, so that you have that long-term rejuvenation. Again, this is no needles. This is the future, guys. This is the sci-fi show or movie where we are we can inject multiple solutions, no needles, almost no pain. We just have to miniaturize it, which we will. So it's very satisfying, if someone's needle phobic, or, even just the average person who's maybe not necessarily needle phobic. It's just another level of comfort for the patient. Really doesn't hurt. Again, it's like a 2 out of 10. And I hate to say it, but guys, usually they're not great with procedures. I think most of you listening probably know that if you've been in practice for a while. Guys do this. I have guys doing this, and they come back and they like to come back for it. They see the difference, and they're not hesitant to have another treatment because it wasn't bad. Everybody's always a little nervous the first time you fire it off at them. They're like, "Ooh, what's this going to feel like?" And you do, a shot, and you say, "How was that? You okay?" And they're like, "Oh my gosh, that's like nothing." I'm like, "Yeah, I know, right? It's really easy." And they're like, "Yeah." And then you just pop, 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 and you keep going. And one of my favorite things to do is to treat half the face, sit them up, put the mirror in front of them, and they can see the difference in the face, how half of it's lifted and half of it's not. And they're so excited. And then I flip them over and we do the other half. So it's a really simple, elegant device. It's wonderful uniform spread of the material. Again, you can control the depth of the penetration by adjusting your fill and your pressure, and it just automatically will dose in there. And you may be wondering, well, how much am I using each treatment? Most of my kinetic lifts, I'm using 1 filler, 1 syringe. Some of them, if they have a lot of wiggle, sorry, that's my dog, a lot of wiggle, if you will, I will do 1.5. Depending on how much you're doing for dermal filling, you might adjust that. For how much catalog to mix up, right? For a keloid, that keloid patient that I showed you with the scars all the way around, I mixed up about 2.5 cc's each time. And that was enough to treat both sides total. 2.5 cc's. So, in that I just approached it the same way I would approach injecting with a needle. How much, what's my strength? What do I want to put in here? And then I would mix it up to that strength and then just load it into the Enerjet. So very easy. I think that's it. Let's see the next. Nope. Here we go. So why I love the Enerjet, even men will do it because it's easy, it's comfortable. Needle phobic patients, they will try it. Again, great last minute treatment for those people who always amaze me by saying, oh my gosh, I forgot to take care of myself. I have a wedding to go to in a week. Very, very natural look, as you saw in the before and afters. It's a very natural lift. So it's nice when people have maybe, they have enough filler in their face. They really don't need more, but they want more lift. This is another way to get that lift. And it's the best keloid treatment I've ever seen. And I think that's it then, right? Yes. So thank you so much. I hope that this was helpful. And if anybody has questions, please ask me.
Ah, that was so amazing. Thank you so much
Yeah.
for that. I was also fighting back tears on with that story about your patient.
Thank
That's
you.
amazing.
Yeah, I mean, that was a moment I don't think I'll ever forget, honestly.
Yeah,
The being able to help her like that, because what was really amazing, like she came in complaining how bad it looked, right? And how she had to hide, so much of the sides of her face and the earrings. And she had these big earrings she made to hide the scars and all. She never mentioned the pain, but
right.
she was just so emotional about it, and it really gets to you. It was amazing.
Yeah, that is so amazing. Both, using it for cosmetic, but also, yeah, like you said, for patients experiencing pain with keloid scars.
Yeah.
Um, Awesome. I'll see if any questions roll in. I have some questions for you. You may have touched on this, but if you can just remind everyone, how long are you seeing results last as far as the kinetic facelift and the dermal thickening?
Yeah, so it's going to depend on the patient, just like kind of everything else. With the lift, I think that they do last longer than just putting a filler in. Um, the I would say probably between a year and a half. Instead of like 9 to 12 months, you're getting like a year to year and a half. My patients are most of them are how should I say, they're always striving for more and excellence, right? With their looks, they may be a little more obsessive, so they will come in a little more frequent than maybe some of the average patients. I know that for me, I was good for a year. I probably could have gone longer, but I'd like to repeat things. So yeah, it's good. It's really good. Love it.
Yeah, it's so long lasting, which is really incredible.
Yeah, because when you can get that, natural rejuvenation process going, it's fantastic. And using maybe like a really thin HA, there's a product now that has a little PDO in it. And if you were to put that in and you use this with the micro trauma and the PDO and the HA, you're gonna get a really nice collagen stimulation for a much longer time.
Yeah, I was actually going to ask you, how are you combining it with your other treatments? I know you have an array of offerings. So how are you able to combine it? And what are you combining it with currently?
Yeah, I combine it with almost anything and everything. I do have a lot of offerings in my office. Again, have been doing this for so long, and being someone who is always looking for, new stuff and what's the latest, what's going on with technology. And that might be a device, that might be a filler, that might be a filler technique. I like to, play around with things and push things and combine things. And so this is a really easy one to combine things with. So you're working on the face, let's say, you want to do some tightening on the face, maybe some RF microneedling, or you want to do an IPL or whatever it is, but you know, this patient also is complaining about laxity. And even though RF microneedling might give you a little bit of tightening, you know, you really want to get more of a lift. This is easy. Just put this into the kinetic lift and boom. Or, you know, the dermal plumping in certain areas, certain patients, it's very nice. And again, just combining modalities is one of the things that I do. And it's always, you know, a nice recommendation that I have for people is, you know, think about how do all of your services possibly complement each other. Obviously, you might have some overlap, but it's nice to think about that and just get a nice plan together for your patient and present that to them so that they can kind of go through it in a stepwise fashion. And this is like, I mean, I would say almost always in the plan.
In almost any situation, for sure.
Exactly.
It can do so much. And yeah, we're such huge believers in combination therapy too. It's really the present and the future, I think, forever within aesthetics. You know, we'll be using combination therapies to address everything. So it's really nice that Enerjet fits into that for you.
Oh yeah,
Um,
for sure. I mean, not to interrupt, but think about when you age, right? You're not aging
mhm,
in one fashion. Your
right,
your collagen's depleting, your elastin quality is depleting, your natural hyaluronic acid is depleting. Some of your fat pads are depleting and shifting, your bones are remodeling. So if all of these things are going on to cause that aging effect, how are you going to fix it with one thing? You
right.
can't, right? You have to do multiple different things to stay on top of it.
Exactly. And I'm so glad you mentioned the hyaluronic acid, how that's depleting, you know, in our skin as we age, of course, like everything else
Mhm.
does. And we always say that those glycosaminoglycans, like hyaluronic acid, they're not talked about enough within the industry. And it's really, really amazing how we're able to deliver that HA into the tissue with that lateral spread and just replenish the moisture, plus the collagen and elastin. It's a win-win for sure, like you said earlier.
Oh, exactly.
Yeah, awesome. So how long, so it's a pretty sophisticated device, right? And someone may think when they're just hearing about it, is this a hard treatment to perform, say for you, right? And
Mhm.
how long does a treatment take you, say, let's say a kinetic facelift?
Yeah, so it is easy to perform, and I have also trained some ancillary staff to perform it. So if I'm just too busy on my schedule, I will hand certain patients off to them, and it's easy, and I feel confident that, you know, they're going to do a good job and it's safe. I'd say a lift takes like, once you know and you've been through a couple, like 15, maybe 20 minutes, including having them sit up and ooh and ah halfway through. Uh, it's pretty easy. You just get very methodical about, like, you just kind of pull, where am I going? You know, where am I moving? Where am I getting the best effect on the face when I pull here or here? You know, it's different for everybody. You have to kind of play around.
Yeah, that's so true. It's nice. It's customizable based on where their movement is. And I love throughout a kinetic facelift how, you know, we're pulling to say, okay, you have movement here, and then you perform maybe like that first line, and then you tug again, and you're like, that movement's almost gone already.
Yeah, it's nice. You will, as the treatment goes along, Leah's right. It does stiffen up, if you will. So the wiggle kind of goes away. And again, I'm so amazed at that my friends of fact, right? Because I'm telling you, it was like crazy movement. And I was like, oh my gosh, this is never gonna work. I'm gonna have to put so much filler in here to get it
Right.
even firm and then to come up. But but I was wrong on that theory, because it turned out that really what she needed was that stimulation of collagen to remodel, and it tightened up a lot, and she looked great. So again, you want to see, is this for everybody? No, I do have some patients who come in and they don't have any laxity. You know, that does happen, and they don't need it, but the great majority of patients do. And you just have to figure out How much movement, how much laxity do they have, where, right? Because that's a little different from patient to patient too, and the vector of pull. So which way are you getting the best effect?
Yeah, absolutely. I love how you call it the wiggle. I'm gonna start calling it
Wiggle, yeah, I chased the wiggle.
Yeah, get rid of the wiggle.
Yep.
Awesome. One last question. So we saw the acne scar before and after. I think it was one or two treatments, if I'm not mistaken. And we all know acne scars are just inherently a little tricky to treat, right?
Mhm.
Let's speak to and speak on how we are also creating a liquid subcision effect with Enerjet.
Yeah, you are. And you're starting to break up that scar a little bit with the blasting in, if you will, of the material. But the other thing that I'd like to mention is that this is going to last a lot longer in a scar. So an acne scar, the circulation is not always the best. And when you put a filler in an acne scar, that filler tends to last a lot longer than when you put a filler in for a cosmetic purpose in a normal situation. So I haven't reached the point yet where I'm repeating my treatments on acne scars. So I imagine that it's the same thing as if I was just injecting with a needle, that it does last a lot longer.
Amazing. Awesome. Well, thank you so much. That was so amazing and informative as always. We really appreciate
Thank
you doing this for
you.
us. For those watching later on YouTube and mysinclaircollege.com, you're always welcome to reach out with any questions and we're happy to answer them. Awesome. Well, thank you, Dr. Hayre. It was so good seeing you again.
Thank you so much. I really enjoyed this. I always love speaking about Enerjet, and if people have questions, let me know. And
Yes,
I
absolutely.
hope this helped.
Awesome. Thank you so much. We will see you soon and have a great night.
Thank you. Bye.
Thanks. Bye.